to being provisionally approved for use, rollout in Australia can be expected in late February, according to PM Scott Morrison. Originally scheduled for the middle of the month, international delays have resulted in a minor pushback. It's hoped that the majority of the adult population, all those over 16 years of age, will be vaccinated against the virus by the end of October this year. This would mean a total of over 24 million people vaccinated in 4 to 5 phases within an 8-month period. Experts agree that an inoculation of this scale is an undertaking of epic proportions. Federal Health Department Secretary Brendan Murphy referred to the rollout as the most complex logistical exercise that perhaps we've ever done in public health in this country. The various phases in the timeline correspond with the different groups to receive the vaccination. The initial phase, Phase 1A, will be the vaccination of those most vulnerable to the virus, including quarantine and border control workers, frontline healthcare workers, and residents and staff of aged care and disability facilities. This phase will cover an estimated 678,000 Australians. Phase 1B will be next. This group includes the elderly, Aboriginal and Torres Strait Islander people over 55 and other Australians over 70, as well as those with an underlying medical condition, and additional groups of healthcare and emergency workers. Phase 1B amounts to approximately 6.1 million people. The majority of Australians will be vaccinated in either Phase 2A or Phase 2B. 2A encompasses the remaining Aboriginal and Torres Strait Islander population, other Australians over 50, and other critical and high-risk workers, while 2B includes all adults not yet vaccinated. The key difference is that these phases will be undertaken with the use of the AstraZeneca vaccine as opposed to the Pfizer vaccine. The Australian government has purchased 53 million and 10 million of each respectively. As for children under 16, provided the Therapeutic Goods Administration approves a vaccine, a final Phase 3 of the rollout will see that they get the shot. $23.9 million has been invested in a campaign aimed at informing the public on what to expect with vaccinations. Certain demographics prone to anti-vax attitudes will be targeted in a bid to minimize conspiracy spreading and to ensure a smooth rollout. Due to significant supply shortages, imports of the AstraZeneca vaccine have been potentially delayed until early March. Although once the issue is cleared, Australia could have access to a total of 140 million vaccine doses.